In 2020, COVID-19 all but brought the world to a standstill. Over the past year, more than 3 million people have died due to the virus. Businesses and economies have been massively impacted, and a socially distanced world has become our new reality. Experts agree that vaccination is key to protecting people and economies from COVID-19. So, after less than a year of unprecedented research and development, the first vaccines became available. By mid-April 2021, around 800 million vaccinations had been administered across the globe. And now, South Africa has joined this international vaccine rollout. The SA rollout plan aims to vaccinate 67% of our population to reach effective population immunity. It's a daunting task, but it can be achieved with the cooperation of the public and the support of SA businesses. To help protect South Africans, these businesses need to be prepared for the rollout and have a clear strategy to support their employees, provide access to the vaccine, and minimize disruptions. Now is the time for people, communities, and organizations to come together for the greater good, because COVID-19 immunity is everyone's business.
It's a good afternoon, everyone. My name is Arabile Kumete, and I have the absolute pleasure and privilege of guiding proceedings for this digital event. Now, at the outset, allow me to welcome you all on behalf of our hosts, Old Mutual Corporate, in collaboration with non-profit healthcare organizations, that's CareWorks, as well as Right to Care. Now, as you know, the theme for this event is Building Immunity is Everyone's Business. And for the next 90 minutes or so, our panel of medical and business experts will be taking a deep dive into South Africa's vaccination rollout program and unpacking what it means for employers and their employees and how businesses can and should be preparing to support and enable the rollout. And this is all to help South Africa get back to business in the coming months as well as the coming years. Now, with the scene set, I'd like to confirm that all COVID-19 protocols have indeed been observed. We are all socially distanced, and when we appear on camera, we are able to then remove our masks. I'd like to take a minute, however, to introduce and thank our esteemed guests this afternoon. Joining us are two business experts as well as representatives of Old Mutual Corporate, the Managing Director, Prabashni Moodley, and in studio is Malusi Ndlovu, the Director of the Large Enterprise Markets Division. Thank you to both of you, Prabashni and Malusi, for joining us this afternoon.
It's good to be here, Arabile.
Awesome stuff. Also joining us in studios, Professor Ian Zane, the CEO of the Right to Care Group and the Director of the Clinical HIV Research Unit at the University of the Witwatersrand. Welcome, Professor. Thank you so much for the time. A lot of knowledge is going to be taken out of you this afternoon, and I hope you can offer it.
Thank you, Arabile. I do hope that I can answer your questions, and I'm very glad to be here.
Fantastic as well. We are also lucky enough to have the experienced medical professional, Dr. Griekie Strydom, who is an independent health and wellness consultant, as well as a member of the Right to Care COVID-19 vaccination task team. It's a welcome to you, Doctor. Thank you so much for the time as well this afternoon.
Thank you so much, Arabile, and I'd really appreciate the invite. Thank you.
Fantastic stuff. All right, then, and last but not least, also joining us remotely then from Cape Town is medical doctor, Dr. Nkateko Msimeki. She is also an executive director of CareWorks, a well-known and highly respected provider of medical services to South African companies and their employees. It's a warm welcome to you, Dr. Msimeki. Hope you're staying safe out in Cape Town.
Hi, Arabile. Thank you for the invite, and I certainly am.
This is such a big topic. Thank you to all of you who have joined us. We have lots to cover. And in a moment, I'll hand over to Prabashni to kick things off for us and give us an Old Mutual Corporate view on things. And then each of our panelists will have a few minutes to share their insights on various aspects of the vaccine rollout. Thereafter, we will go into a question and answer session where we will answer as many of your burning questions as possible about the rollout and about how your business can best prepare. We are, of course, live, and we would like to keep this conversation as interactive as possible. So we will be doing a few polls throughout the event as well using Mentimeter. It's a really easy way to interact with us. All you need to do is grab your phone and scan the QR code that's on screen right now with your camera. That will take you straight to the site where we will be loading questions. You can then also use the address www.metimeter.com and code 66700401. That's if the QR code doesn't work for you. We have also activated our WhatsApp line for you to use for questions and comments. The number is on your screen. That's 071 132 3408. We will do our best, of course, to answer as many of your questions as possible throughout this time. Our final note, if you are, of course, a member of the Financial Planning Institute, your attendance does qualify you for 1 CPD hour. So make sure you claim those hours. Right. With the housekeeping now out the way, let's get down to business as we set the scene and talk about why building immunity is everyone's business. Now, it's my great privilege now to hand over to Prabashini Moodley, the Managing Director of Old Mutual Corporate, who will briefly set the scene and offer insights into Old Mutual Corporate's position regarding the COVID-19 vaccine, as well as the efforts the business has made thus far in providing COVID-19 support and assistance to businesses across South Africa. It's over to you, Prabashini.
So much, Arabile. Ladies and gentlemen, it gives me great pleasure to welcome you all on behalf of Old Mutual Corporate to this valuable and very topical webinar. At the outset, I would like to thank all the people who worked so hard in putting this webinar together, from the Old Mutual Corporate Group Assurance product team, CareWorks, and Right to Care. I'd also like to take the opportunity to say thank you to our expert speakers, from Professor Ian Sanna, Dr. Kriki Stradum, Dr. Nkateko Msimeku, and of course, Old Mutual Corporate's Malusi Ndlovu. As we were preparing for this webinar, and in fact, as awareness spread about it, we received a fair bit of feedback and questions, including why, as Old Mutual Corporate, a business like ours, is involving itself so significantly in the country's vaccine rollout. The short answer is that as a responsible business, we do not believe that we have an option not to involve ourselves. We have a role to play in supporting people and businesses during this very challenging time, and possibly even more importantly, helping all South Africans, whether individuals, businesses, or corporates, to protect themselves from the health and economic risks presented by this pandemic. Of course, we are very aware there are multiple opinions about the COVID-19 vaccine, and we fully support every individual and organization's choice. That is, and we want to be very clear about where we as Old Mutual stand on the topic, which is very clearly that we are supportive of government's vaccine rollout program. For us, providing this COVID-19 support, assistance, and education to people and businesses has been something of a no-brainer since the virus first reached South African shores. In fact, since very early in 2020, when the first national lockdown started, we partnered with CareWorks to offer a comprehensive range of COVID-19 support and assistance to all of our business clients. We've been partnering with and supporting South African businesses. And in fact, we have no intention of reducing that support as we move towards the vaccine rollout. We are in the final stages of planning a number of additional assistance packages, including financial interventions specifically aimed at equipping our clients to minimize any possible risk of disruption on their business operations. And to most importantly, educate and inform their employees and facilitate vaccinations for those who choose to have them. In closing, I'd like to invite any business owners who may be watching this webinar to contact us via the channels shown on screen to discuss ways in which we might partner with you and provide support for your COVID-19 challenges and during the vaccine rollout. Old Mutual Corporate is of the sincere belief that the best way to overcome COVID-19 and set South Africa back on a path of economic recovery and well-being is through information sharing, collaboration, and partnership. And we trust that this webinar will facilitate all three. To end off, we've put together a short video to show you the comprehensive package of COVID-19 support. It's available to all of our clients, mostly at no additional cost. Thank you so much, Arabile.
When COVID-19 and the hard lockdown impacted on South Africa, Old Mutual acted quickly to support and help all its clients, both individuals and businesses. Since early 2020, Old Mutual Group Assurance has partnered with CareWorks to offer our corporate clients a multi-pronged COVID-19 care and support service to reduce the impact of COVID-19 on their operations and employees. These Old Mutual Group Assurance support initiatives include employee care and counseling, employer advice and support, support and case management for employees with COVID and long COVID, and in-claim disability support, vaccine assist. Most of these support services are provided free to Old Mutual clients and can be customized to their exact needs. In this way, Old Mutual is delivering on its responsible business promise by partnering with people and businesses to help protect them against the impacts of COVID-19.
Prabashini, thank you so much for that amazing work having been done so far. It is clear then that Old Mutual Corporate has made a valuable contribution to supporting as well as helping employers and employees to manage the health and business impacts of COVID-19 to date, and that the intention is to continue building on this valuable support through the vaccination rollout. With the Old Mutual position and commitment to COVID-19 and the vaccine rollout clearly defined, let's talk about the big picture then and engage in that now. Now, as we get the conversation going, I'd like to bring in Professor Ian Zane to offer us a big picture view of where South Africa currently finds itself on its vaccination rollout journey and provide his insights into the practicalities of the rollout in the coming months. But before I do that, though, I'd like to remind you that you can submit any questions you have via our WhatsApp line or using the webcast question field. At this point, let's also bring in our first Mentimeter poll, which you can then respond to while Professor Zane is presenting. Please scan the QR code on your screen now or use the link in your browser to answer yes, no, or unsure to the following question. Question is, do you believe that South African people, businesses and government are adequately prepared to achieve population immunity by means of vaccine rollout? Options, of course, yes, no, or unsure. If your response to the poll is unsure, hopefully Professor Zane will be able then to shed more light on this question for us in the next few minutes, and you can answer that one. Professor Zane, so as we've noted, there have been so much, news, some misinformation somewhat as well about South Africa's vaccine rollout. And as someone who has first-hand knowledge with regards to this as well, then give us an update on where we are perhaps in this journey.
So I think that the importance lies in all of the decision-making that predominantly the National Department of Health has to make. Since the beginning of COVID, I have been centrally involved with the Minister's Advisory Committee. We focused first on the treatment response and prevention of COVID with whichever means we could. We have issued a number of advisories, the majority of which the National Department of Health has implemented on social distancing, different degrees of lockdown, and all the decisions on the economy, education systems, etc. in South Africa. But it's become patently obvious that we have a gap at the moment between the second and the third wave. It is, I think, from our advice point of view, we will unfortunately reach a third wave. It is almost inevitable. In my view, I'm surprised that the third wave is as delayed as it is at present. And that is predominantly, I think, driven by the shock that South Africa went through in the second wave, and by the social distancing. So our first recommendation is vaccine plus social distancing will get us out of this situation. So as a leadership member of the Sisonke team, we were provided with the opportunity by Johnson & Johnson to roll out the remaining stocks of research vaccine.
Sure.
This opportunity came about at the same time as the decision that not to go ahead with the AstraZeneca rollout. I personally think that the decision not to implement AstraZeneca was not the correct decision, and we should have in fact used that in whichever form possible to, even if it provided only partial immunity or partial protection. But at this time, almost any vaccine that we can access, we need to implement. And there are, on that point, there are good examples such as Chile, where the country has gone ahead with a public health approach, trying to reach as many people as possible with the Chinese-produced Sinovac vaccine. And in so doing, the case rates have declined very rapidly, independent of variant or not variant. And if there's a question on variant, we can certainly address that. But I think we should take a public health approach. So Sisonke has, because of the tranches of vaccine that we received, has been a very complex program to implement. But I think that indeed the key elements that we have learned is that the national data systems, the so-called electronic vaccine data system, EVDS, I've worked very closely with the team implementing that. It is totally up to the situation, and whether we are implementing public or private, we do need to go for one national system. And that lesson comes from a place like Israel, where the decision to use one data system and implement one program has led to the maximized coverage and remarkable greater than 95% reduction in incidence rates and hospitalization.
And one can imagine less confusion as well with regards to information and the like. So a lot of the focus shifting in and around, particularly with regards to, for example, Johnson & Johnson being paused at some stage. And then, the question becomes, how will that impact the continued rollout of vaccination, especially in South Africa, and who gets vaccinated too?
So that's a very specific question, right? So the Johnson & Johnson Sisonke vaccine study is a study, and therefore it is subjected to the regulatory approvals of SAPRA and of the ethics committees. We saw the signal. The study team volunteered immediately to engage with SAPRA, engage with the Minister of Health, had the conversation. We're talking about 4 hours, right? From getting the signal from the FDA, within 4 hours, we had made the decision with all bodies to actually place the study on hold. That is a technical piece. So we have new safety information that we have to advise all of our participants about. We have continued the discussions with SAPRA, and literally this is on an everyday basis. Even last night until midnight, we responded to the latest round of queries from SAPRA. We do anticipate that SAPRA will approve. On my way here, I saw that the Cabinet has indeed now said that that they will unblock it. I'm not sure from a regulatory point of view that the Cabinet can do that without SAPRA, but I do anticipate that we will have approval. So we anticipate that we will restart that vaccination program on Monday. The interface between that and the national rollout will happen very quickly thereafter. So we have transition plans. We're focused on healthcare workers as the Sisonke program ends, we probably have in the region of another 1 million healthcare workers in the broader sense of the term, community healthcare workers, organized labor, etc., that have not yet been addressed. So there'll be a rapid transition to J&J.
Yeah.
The availability of the J&J vaccine is likely to be released next week. The product is in South Africa already. The steps to actually release it will be finalized next week.
Yeah.
The Pfizer importation, as is, I think that's reasonably public knowledge, is going to also happen next week. There is a quality assurance step that needs to be undertaken, and we anticipate that in about the 10th of May, the Pfizer vaccine will become available to the market.
Yeah.
The market being the DOH collaborative market, right?
Yeah. What's government's then sort of stance or current regulations with regards to private or even corporate entities then, distributing the vaccine?
So I view the distribution market in 3 tiers. I view it in a public, which is, as Right to Care, we are most supportive of the National Department of Health provinces, the data systems, everything that goes on in the system. So that is Right to Care's primary focus, and making public sector vaccines available. I view the second tier as the private sector, those medically insured, and the delivery systems that have worked incredibly efficiently at what I would call large-scale sites like Mill Park, St. Augustine's, Green Acres Hospital in Port Elizabeth. And I think that there's agreement that there will be vaccine made available in fairly substantial volumes as the vaccine arrives in country to that group of implementers, if I could call them that. Yeah. And then I have, and I'm very happy with the work that we're doing with Old Mutual, because I have been plugging since the beginning of January that corporate needs to, in fact, pay attention.
Yeah.
And it comes out of our deep experience of HIV and TB programs in the corporate environment, occupational health and safety businesses that, in fact, have got the capacity to ramp up vaccination and interventions in the system. We have our partner CareWorks on this webinar, but there's at least 20 such businesses in South Africa that can deliver this. And I think that tier is critically important because of this interface between business risk and mitigating that risk. Yes. And actually getting the population secured. From a public health person, I want the population secured, but I can understand the corporate need. And so those 3 tiers will have access to vaccine. The actual steps to getting there are fairly complex, and we are engaged with the National Department of Health to assist in those planning steps. I unfortunately cannot confirm that it's all done today.
Yeah.
But I can, from my experience of working with the National Department of Health, I can assure the corporate South Africa that I anticipate by the 17th of May that we, in fact, will have a plan.
That is really good news and really great insight as well, Prof. Zane. Thank you so much for that. I mean, of course, just a little bit earlier, we had asked the question as well to you all, just with regards to whether you believe that South Africans, whether people, businesses or government, are even adequately prepared to achieve population immunity by means of the vaccine rollout. And it seems that a lot of people have actually gone for no as an answer to that question. We'll try and get the exact amounts. I mean, Professor, what would you say to something like that? I mean, a lot of people feeling that no is certainly the answer. Would no be the current stance?
So what do you need for a vaccination program? Supply.
Yep.
Right? So I think that the supply part has been in the hands of the Minister of Health and Treasury and the Minister of Trade and Industry. I would have preferred more transparency on exactly where they are in those negotiations, but from where I sit, we are seeing a waterfall of vaccine arrival.
Okay.
Do we have the correct vaccines? I think the basis of our data at the moment, both laboratory and clinical data, certainly that applies to Johnson & Johnson and Pfizer. I think that there are alternatives, and we may end up using alternatives. As I said in the beginning, I would have not given up the opportunity of the AstraZeneca vaccine. I do think that there's still ongoing speculation about Sputnik vaccine and whether it will work for our variant. We're certainly aware that Moderna has made a variant-specific vaccine that actually is going into clinical trials now and is likely to become available within months. So do we have a vaccine? Yes. Do we have the people in South Africa willing to vaccinate? And I think both public and private and the occupational, the sort of intermediate space, we can organize that.
Sure.
Do we have the advisories released by Right to Care publicly on how to set up a vaccine site? What do you need to do this? You know, from the logistics to the computers to the vaccinators, you know, what does a vaccine site look like? We do have those. They are publicly available. And then do we have the ability to actually monitor this from a data perspective? 100%. What I really would like corporate South Africa, and this is almost a plug to B4SA, we need to buy into one EVDS system. Yes. And the reason is the relationship between demand and supply. If we can predict the demand of vaccination at a particular site, we can predict the supply of vaccine to ensure that this is maximally optimized and efficient. And then all these relationships can be built, whether it be at Old Mutual's head office, organizing their own vaccination program, or it be at Dis-Chem asking to receive 200 vaccines a day. And I think that we will actually have predictive stock management. As soon as we've done the first 2-3 weeks of this supply chain, we will be able to resupply the GP, the nurse, the Dis-Chem site with the right volumes of vaccine. And then there's the last final question that I think where we're not ready is that the whole question of reimbursement. So as a non-profit entity, obviously we work with donor money, so we never worry about reimbursement. However, the whole question of how the financial part of this is working, I don't think has been transparently addressed, but there is a work stream in B4SA working with the Minister and Treasury to resolve.
So more clarity just required perhaps then on that one. Thank you so much then as well for that response, Prof. Zane. I think very critical to understand that there are so many elements to this. It isn't just going to be an easy sort of just roll it out. There are particular elements. So thank you to everyone who did respond to that poll as well, and all those who have even sent through their questions for the panel to discuss. We will get to those a little bit later. Please do keep them coming in, though. Details, of course, will be on the screen now and are on the screen. Now, though, given the poll results, it seems like a good time for us to hear from another one of our business experts, an Old Mutual Corporate's representative, as we continue to discuss readiness for the vaccine rollout. Now, Malusi Ndlovu is Director of Large Enterprises at Old Mutual Corporate. Malusi, thank you so much again for the time. Please let's perhaps start off by sharing perhaps your thoughts, right? And particularly on the vital role of the employee benefits industry and particularly risk cover providers. And that is in helping organizations to deal with the impact of COVID-19.
Sure, Arabile. So the South African employee benefits industry is one of the most advanced in the world. A lot of people don't know this. In fact, you know, it touches 6 out of 10 working South Africans with some form of cover, either through their retirement fund or through their employer. And we at Old Mutual view this as a responsibility and an opportunity to be part of this building population immunity that we've been talking about. You know, if you look at the insured market specifically where group insurance, life and disability cover and so on are provided, it's been growing quite significantly even prior to COVID, which shows that people do appreciate this type of cover and there is a demand for it from employers, from retirement funds and from members as well. And of course, the value of that cover has now come to be seen as we saw excess deaths spike in 2020 and with the second wave that we've just come out of. So we really think that this places the onus on us as an industry to not be a bystander, but to look at how we can, through a shared value approach, ensure that we get as many people as possible to achieve this population immunity, and we get all the stakeholders around the table to be involved in that.
Now, employment-based cover did also provide significant value during this time. Let's talk a little bit more about exactly what that looked like and how exactly it impacted.
So, at Old Mutual Group Assurance alone, we provide cover to about 2 million people through this form of cover.
Sure.
So that reach is very wide. It's across all industries that you can think of. It's across all demographics that you can think of, etc. And as recently as the end of 2020, we identified 1.2 billion rands worth of separately identifiable COVID impacts. This is ranging from the death claims that we've had to pay due to excess deaths related to COVID, as well as, sadly, putting away reserves for what we anticipate as excess deaths coming out of the subsequent waves. Sure. Now, that's quite a somber thought to fathom, that we have to put this money aside for deaths that are still coming, which is why then it's so important to look forward and say, what is it that we can do collectively to reduce this impact? And, we believe that the path to economic recovery requires employers to open up quickly and safely.
Yep.
And to do that, population immunity has to be achieved. So we are a part of this. We are working together with our partners, Right to Care, CareWorks, as well as Business for South Africa and other organizations to take this forward, because we believe that by going through the worksite-based approach, we can reach the maximal number of people, whether it's with education, basic information, or with the third tier that Prof. Zane was referring to of the vaccine rollout.
One can just imagine the day we have that announcement that we've reached population immunity. Boy, that would be such a great day. All right, let's talk then, Malusi, just about Old Mutual Group Assurance's approach to all of this. What is that?
Yes, so for us as a provider in the market, we are still in the market. We're continuing to provide this cover. We've not stepped away. We have not included any COVID-related exclusions. We've not changed our terms and conditions.
Yeah.
We're continuing to pay claims. We're seeing disabilities that are coming about as a result of COVID, which we never had before. Wow. And we're paying for them because that's what we're here for. So we are quoting, we're active in the market. Now is not the time to withdraw because of the risk. Now is the time to demonstrate the real value of this cover. And in addition to that, we also believe that it's our responsibility to spread as much of the factual information as possible, to put together experts such as we have today to bring their insights and make sure that organizations are operating from a point of knowledge and understanding, so that as they plan for themselves through their human capital functions, through their wellness functions, they've got the latest and most up-to-date information. And of course, for our clients, we'll continue providing the business support that we have. All of our clients have access to support in terms of assessing their readiness for the vaccine rollout, and recommending the next best steps that they can take. Things like prioritizing different populations, things like spreading information into the workplace so that people are aware what needs to happen. And ultimately, I see this evolving into how employers also plug into the central database, so that there can be a common view of where populations have been vaccinated. And we continue to provide this support for the employees of our clients as well. They have access to a call center, which gives them factual information. It provides grief counseling. It provides contact tracing. Our estimate, in fact, Arabile, is that the contact tracing we're providing reduces onward transmission by up to 30%. And that call center is also evolving now to also provide support on long COVID, because that's also something which is going to become topical as we move ahead. And just helping people to assess their symptoms, understand how susceptible they are to this long COVID and what and referring them to healthcare providers. So that's really, the responsibility we see for ourselves as Old Mutual, is to use the convening power and the stakeholder power of Old Mutual to bring people together, public and private partnerships, so that we work towards this goal of population immunity. We will get there at some point. The question is how quickly we get there. And the sooner we work together, the sooner we can get there.
Up to all of us to play a particular role in trying to do that, right? Thank you so much for that, Malusi. Very, very interesting as well. Just to hear about the importance and value of effective workplace initiatives and supporting the vaccine rollout and even stemming the COVID-19 tide, of course. So critical. Now, in a short while, we'll be hearing from Doctors Msimeki as well as Stradom, but we have received a number of questions via our Q&A channels that point to the fact that there's still a lot of concern amongst business owners about some of the misinformation that is circulating about the COVID-19 vaccines. Now, while that is not the focus of this webinar particularly, we did try to produce a short video highlighting a few of the most prominent myths that many members might still have and the importance of addressing those myths. And this feels like an appropriate time then to flight that video. We'll be back with you right after this.
Medical experts agree that vaccination is an effective defense against COVID-19. Unfortunately, there is a lot of misinformation still being spread about vaccines, and this is placing millions of people at risk. Correcting this situation begins with debunking the harmful myths, especially the following 5 most prevalent untruths currently doing the rounds. The first such myth is that the vaccines are unsafe because they were developed too quickly. The truth is that scientists were able to develop the COVID-19 vaccine so quickly because massive amounts of money and resources were invested into the process, given the importance of vaccination for the protection of people around the world. The second common myth is that getting vaccinated actually gives you COVID-19. In reality, the vaccines don't contain any live COVID-19 virus cells, so they can't give you COVID-19. They merely help your immune system to combat the virus if you come into contact with it. A third common myth is that young or healthy people don't need to get vaccinated. This is a dangerous untruth because nobody can ever know how their body will react to the virus, so even young and healthy people can get very ill or die from COVID-19. Those who have had the virus can also get it again. So, the safest course of action for every person is to get protected by having a vaccination. Myth number 4 that urgently needs to be stamped out is that the vaccines have microchips in them to track you. The truth is that there are no secret ingredients or chips in any vaccine. In fact, manufacturers are required by law to publish a full list of all the ingredients in their vaccines. And a final dangerous myth that needs to be addressed is that vaccines cause infertility or birth defects. To date, there is no scientific evidence to support these false claims, and there is no vaccine of any type in the world today that changes the genetic structure of the recipient. Next to vaccination, one of the most powerful weapons we have in the fight against COVID-19 is information. As employers, it's up to us to bust the dangerous vaccine myths and give our employees truthful, science-based facts to make informed vaccine decisions. Because immunity is everyone's business.
Of course, a short video just highlighting a few of those myths that many individuals, not only in South Africa, but across the world, might still be focusing on. Of course, it's clear then that educating and most importantly, informing employees about the vaccine and helping them to prepare themselves adequately for the vaccination rollout is of utmost importance when it comes to employee readiness. Now, as we focus on employee readiness, I would like to bring in Dr. Nkateko Msimeki, the Executive Director of CareWorks, to expand on the willingness and readiness of employees to receive the vaccine. Now, before we hand over to Dr. Msimeki, I'd like to remind you that you can submit any of your questions that you have via our WhatsApp line or using the webcast question field. I'd also like to draw your attention then to our second Mentimeter poll, which you can respond to while Dr. Msimeki is providing her insights. Please scan the QR code on your screen now or use the link in your browser to answer the following question. The question is, do you know what to do if one or more of your employees refuses the vaccine? Of course, yes, no, or unsure are your options. Dr. Msimeki, let's get straight into it then as we talk employees' willingness as well as readiness for the vaccine. What does your data suggest?
So, thank you. Though there is no readily available data on employees' readiness and willingness in particular for vaccination, there is data available that was conducted by organizations like CDC Africa and University of Johannesburg and HSRC, looking at South Africans' readiness and willingness or awareness of vaccines. And that data shows that 67% of South Africans say that they would or probably would take, definitely would or probably would take the vaccine. And 18% said that they would not take the vaccine if it were available. And 15% said that they're unsure. I think what the data shows us is at the time when it was published around January, showed that there is a large lean to the positive. And we know that that can differ depending on the time with where we are now with the vaccine rollout program, but also every organization could be different in what that actual data looks like.
What makes employees then more willing to perhaps be vaccinated? And also, what, in your opinion, makes them a little more hesitant?
Yeah, so I mean, taking some of the learnings from some of those surveys as well, the two most highly ranked reasons for why people would be willing to vaccinate. The first was being, I want to protect myself. And the second being, I want to protect my family or friends. So there's a real sense of social solidarity around people who do want to be vaccinated. And there's also a high, people who have high trust in government and science, the vaccine development process, and down to the employer even, also found to be more for the vaccine than people who weren't. And when you look at some of the reasons, the most common reasons, outside of some of the things, the myths that the video showed, why people are hesitant to be vaccinated, the two most commonly cited reasons, one is safety. And when you're talking safety, you're talking about the vaccines were developed too quickly, or we don't have enough data on side effects and long-term effects of vaccines. So how do I know it's safe? And the second question becomes about, how do I know this will work for me? And in South African context, with the variant that we've seen, becomes a question of, how do I know that the vaccine will work against the variant that we have?
I guess the key then is always going to be education. Do you feel that employees then require a little bit more of it, a little bit more, whether it be training even, education, knowledge and understanding of what comes next?
So certainly, and I think if we look at the factors that we've identified and just spoken about coming out of the data and looking at the myths that are circulating, and even the requests that we're getting as CareWorks from employers around providing awareness and more information on vaccines, we can see that there is a real need to be providing employees with access to reliable, science-based, accurate, up-to-date, non-coercive information and education. And I think what's important about that is, in order for us to get employees ready through those education campaigns, they have to be firstly equitable. And that's not normally something you think about when you think of education. But I mean, it's something employers have spoken about, to say, because there's such varying access to information education, be it social media, news outlets, or medical schemes, there's such an opportunity for employers to be providing that leveling out and providing that consistent information and education that is scientific and accurate. But also it's about engaging with your employees to really identifying what are the fears and concerns particular to your organization and addressing those in particular with your education campaign. And lastly, which we've also seen we're trying to do with different campaigns, is about addressing the why of it. You know, it's not enough for you to say to me, put on a mask, without explaining to me why I need to, or explaining to me what the different masks do. And it's the same thing with vaccines. It's all well and good to say on a poster, it's safe because it's being addressed or regulated by this individual. But sometimes you have to walk the road with someone and really, truly engage with them to explain how the process happens for the vaccine to get into your arm and why we're sure that it's safe.
Yeah.
There is a lot still education.
So I guess labor issues then are key to what you're saying when it comes to employee readiness as well.
No, definitely, they are key. And I think what employees want to know is, how does the vaccine program and the choices that I make related to that affect my job safety and security? And I think at the main concerns and questions that generally come up is around, am I going to be forced to be vaccinated? And if I do have a right to refuse, what is that impact going to be on my work? Am I going to have to take time off work to be vaccinated? And how will my employer prioritize, or who does get a vaccine and when, and can they even do that? And I think to address the one aspect, trying to address them all right now, is if we look at mandatory vaccination, for instance, the president has spoken at length about how vaccines will be voluntary. And currently there's no legislation that says that any compulsory vaccination legislation is available. Disclaimer is, I'm not a legal expert, but I would highly recommend that any organization that is considering going down the mandatory vaccination route to get a legal opinion and decide on what parameters they're able to do that. But also, I think importantly is to think about, is it actually even desirable for you to go down that route? What is the long-term effects on trust, employee morale, liability that you might be opening yourself up to if you do go down the mandatory route? So if you take a leaf out of HIV, I think that is the alternative for us, is where we couldn't make HIV testing mandatory. What we did learn, though, was by having good education, collaboration, and communication across stakeholders, you could get very high levels of buy-in from staff members to be HIV tested. And we can use the same approach with vaccines.
Yeah. Yeah, I'm finding this conversation so riveting, really. Our second poll results are also in, and we did ask the question, do you know what to do if one or more of your employees refuses the vaccine? And we have just some of the numbers. We have 43 people who have actually said no, they don't know what to do in a situation like that. Dr. Msimeki, I'm sure you'll agree then that this is interesting feedback from our audience, right? Is there perhaps a way you could perhaps give any thoughts, insights into what they could do in a situation like this, where the education could come from as well for them?
No, I think it's interesting feedback, and it's also not surprising feedback, because there's a lot that's uncharted territory when you're thinking about the labor issues related to vaccines, and a lot there's no guideline for. But I think the first principle being that if you have a right to refuse to be vaccinated, then it has to be respected. I have read some labor law people suggesting that potentially people who refuse could be offered to work from home, if that could be made possible, or to be given more isolated positions which are de-risked, so to speak. I do think you have to consider that very carefully, particularly if you might be opening yourself to elements of discrimination and such. But I think the alternative thought, again, is to remember that vaccines are one element of our COVID strategy. And Prof. Sane actually mentioned that today. The government strategy is to vaccinate and isolate. So there are ways you can still protect your employees who refuse to be vaccinated. You're still wanting to create that social distancing. I mean, you can still be wearing your mask, you're still sanitizing and washing your hands, because there's still going to remain important protective mechanisms, even with vaccination.
Yeah, thank you so much for that, Dr. Msimeki. Couldn't have said it better myself. And thank you again to everyone as well in the audience who is participating in these polls. I hope you're finding the results as interesting as we are. Of course, it sheds so much information. It is, however, time now to hear from our last panelist, Dr. Strydom, who will be providing her insights into the role as well as responsibilities of employers in supporting and facilitating the vaccination rollout. Now, before I hand over to Dr. Strydom, here is our next question for you. This time, if you're an employer or representing a business, please scan the QR code on your screen to answer this question. who do you believe is responsible for ensuring that employees in South Africa receive the COVID-19 vaccine? Your options are employers, government, employees, or all of the above. As before, please do keep those panel questions coming in. We will try to get to them soon as well. Dr. Strydom, though, I am very keen to get your take on today's topic. Just if I perhaps just think about it a little bit more as well, planning just seems to be key to this entire process.
Absolutely, Arabile. I mean, if you don't plan, if you fail to plan, you plan to fail.
Yeah.
And that's the bottom line. And I would suggest that employers start planning as soon as possible and not delay and wait for everything to fall into place. You know, we don't have a course called Pandemic 101, so none of us have studied this. So it is a little bit like a roller coaster, but they have to start doing their planning and saying, what are we going to do about vaccines? How are we going to do this? And rope in the right people, you know, your resources like Old Mutual and, you know, your health and wellness experts. Rope them in to help you to start planning, you know, with regards to your response to the vaccination. And whether it is now just a communication aspect to get your employees to say yes to the vaccine, however it's given, or whether it is to actually roll it out on site, which is definitely a suggestion that we make as an additional. But there's a lot still that is not answered. And so a lot of employers would sit waiting and not do anything because they're waiting for all the blocks to fall into place. And that is going to be too late. If on the 17th of May some miracle happens and suddenly vaccines become miraculously available, ASA. So then you can't then start saying, okay, well, what do we do? You know, how do we go about it? So start today and get a group together, task team together, get your experts on board and start your planning today as to what your response is going to be. Look at the costings. What's the cost impact going to be of sending your employees to Dischem for a vaccine and a whole day out of the office versus doing the vaccination on site? You know,
Yeah,
do
so
your own
important
cost calculation. You just need to know what a person earns per hour.
Yeah.
To calculate what it costs for him to be out of the office for an hour.
Yeah.
Whereas if the vaccine's done on site, you know, the experts come there, they set up, they do the vaccination, nobody leaves site. You know exactly how many people were vaccinated. You're not going to know their names, but you're going to know who, you know, the percentage that was vaccinated. You're going to know how many people had bad responses. You know, it's going to be so much easier for you. But every company has to start that planning process and the discussion. I think Old Mutual's done a fantastic job of actually opening the discussion because everybody was waiting for all the results. And get engaged with Business for South Africa and see what initiatives are running there. You know, just start the process.
Yeah. So what about then where occupational health facilities are then available? How does an employer decide on insourcing or outsourcing, particularly that vaccination process?
Look, as Professor Zana also said, you know, our occupational health facilities can be upsourced to cope with the additional vaccine. But to think that you're going to just take your existing occupational health facility and switch them over to a vaccine facility would also be ridiculous. Because if you're a mine and you're responsible for annual medicals and health and safety regulations, you can't stop your annual medicals. You have to do your core business. You have to do what you're there to do, which is occupational health facilities, looking after the diseases, disease management cases and so on. So you can't take those healthcare workers and say, okay, now you're going to go vaccinate and leave the medicals because something else is going to fall over.
Yeah.
You need to make sure your core business can operate and run. So it is going to have to involve your occupational health facilities, definitely. But you have to understand that you're going to have to expand, probably by outsourcing, you know, and it's not going to be on a continuous basis. It will be for the vaccination period. Most companies know of organizations that would be prepared to do this, exactly the companies that were doing HIV screening on site, you know, and again, you know, if you keep it on site and you just, you know, use what you've got and you plan on site, you're going to get much better employee uptake. I mean, we saw that with HIV screening when we said to people, you can go to Dischem or Clicks for your HIV test, nobody went. When we brought it on site, 80% of the people got tested. So you're going to have the same with vaccines. People are going to say, yes, 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 I'll go, and then they don't go. So the occupational health facilities do have to play a critical role, especially in oversight, especially in vaccine, keeping the vaccines cold, giving the medical attention where it's required. But you're going to have to understand that there is going to be an element where you have to get more resources.
One imagines that with, as it is with any sort of change management process or program, buy-in is going to be key to the success of it as well.
Absolutely. And if you don't engage right from the beginning, from your exco, remember on your exco, there are also going to be people that believe myths.
Yeah.
Okay? Don't believe that it's people of low intellect that believe myths.
Of course. All of those that were there aren't necessarily of low intellect,
Exactly,
right?
Exactly. And I mean, I've engaged with medical professionals that are skeptical. So, it really is key that you actually get your exco on board with you, that you get your senior management and senior management on board. Everybody has to agree on the process and going forward, because they also influence people. Remember, those people are influencers in your business. And then your unions, your workplace forums, those are serious influencers. So if you can't get them to be keen on vaccinations and get excited and say, yes, we've got to do this, then you've got no chance of succeeding. And then ultimately, obviously, get your employees to buy in. And that's going to be a trust issue, like Nkateko said. It's going to be about the employee trusting that the employer isn't going to force him to do something which he doesn't want to do. But also, in an employed situation, you've got a captive audience. Yeah. You've got people who influence their peers. We had wellness champions and, in HIV times. And the peers influence one another. So you want a positive influence. So the engagement needs to take place now before the vaccines become available. Yeah. That's what I'm saying. You get ready and make sure that you start engaging with all those stakeholders right now. Don't wait for the vaccine to drop and all the blocks to fall in place, and then suddenly there's a poster and says, here's vaccination today.
Yeah.
Because that is not going to work. We know that from the HIV.
Plan, prepare, and get ready.
Exactly.
Effectively.
And
is
engage.
And engage.
And then get ready.
Yeah. Let's make this a little bit practical now, if you'll allow, and talk about just actual physical vaccine facilities for employees and perhaps the time needed. We spoke a little bit earlier on, just with regards to if they step out the building, it may cost you a little bit more than if they're in.
Yeah. So when employers have to prepare for vaccine facilities, if they decide to do it on site, they need to understand that they can't disrupt their entire business. So they can't take up half their shop and say, we're going to vaccinate here. Their business has to run. Yeah. Because the purpose of the vaccination is to actually keep the economy going, one of the purposes.
Of course.
So it's really important to understand that it is going to be something that's sort of on the side, on the site, but not something that's going to take up your business space so that you can't operate your business. So that's important. It has to be registered as a master vaccination site. Okay, there are regulations around that. There are experts that will help you specifically with that. So it's a matter of you need to know that your site has to be registered. It's not like with HIV screening where you can just bring your tents and screen people. We're going to have to register the site as a vaccination site. So it's not that cumbersome. I mean, it's completely doable. You just have to follow the steps and the processes and so on. But we need to think about the facilities that we use and so on. And to an extent, the facilities are less complicated than with HIV because you don't have the confidentiality issue. You don't have to have an enclosed gazebo space where nobody can hear what you're saying. I mean, everyone's there for a COVID jab. So, you just open your arm and you get the COVID jab. Yeah. So you don't need a fancy space and so on. But you do need a seat for a person to wait for 15 minutes after their vaccination, which we didn't have with HIV. Sure. So, there's all these logistics.
Socially distanced as well.
Yes,
right?
and socially distanced and all of those. So there's all these logistics that employers need to consider. And that's why it's not such an easy thing just to insource it and do it yourself. It's not, it really isn't going to be like that and people can do it. So I would suggest, there's so many free resources available. Right to Care have made a lot of resources available. We've built models, costing models. This stuff's available. People need to get into contact, and even Business for South Africa are building certain models and so on to do this.
Dr. Strydom, I don't know if there's any more information you could have given us. That was really, really pertinent and important. Thank you so much for that. It's clear then, of course, that irrespective of their personal views or opinions about the vaccine, business owners do have a key responsibility to help educate as well as inform their employees so that they can make up their own minds and then also enable access to the vaccine for those employees who choose to receive it. Of course, all this needs to be done in a way that now limits disruption to the business itself, as Dr. Strydom said. Now, in light of what Dr. Strydom is indeed saying, the results of our third poll become very interesting. In response then to the question, who do you believe is responsible for ensuring that employees in South Africa receive the COVID-19 vaccine? There are your results then. All of the above. 62 people saying all of the above. Which is interesting to get 10 people there, still having said government, of course, as the second highest, with employees, then employer falling out in that ranking. Dr. Strydom, I'll get some comments with regards to you then. All of the above is, of course, the right answer with that one, but it does tell you that there are some people still relying a lot more on government to kind of get things right.
For sure. And it's going to cost the businesses in the long run.
Yeah.
You know, I mean, an individual's opinion might be that it's the government, but if you look at the whole, the business case for vaccinations and for taking responsibility, you've got to make a decision that is everybody, you know, and if the employee doesn't buy in, you know, the employer can't vaccinate him without his buy-in.
Of course.
You know, if a government can't vaccinate an employee without his buy-in. So, you know, it's definitely all of the above. And it's really critical to get everybody on board.
Yeah, the sooner the better. Thank you so much for that, Dr. Strydom. Really appreciate it again. And thank you again to all of our panelists as well for the information they've shared with us today. Of course, we'll get into the Q&A session and they'll help us with that again. It is time now, though, to move into our most interactive segment, as I've just noted, our question and answer segment, where we'll bring in as many of your questions as possible. All right then, as I mentioned a little bit earlier, we do have a lot of your questions coming through, and there's only so much time, unfortunately. So we'll try to get through to as many of them as possible. Our WhatsApp number and on-screen question channels will stay open until the end of the webinar, so please feel free to keep sending your questions through. With that, then, let's get straight into our Q&A session and get it underway with our first question to our panelists. This one has perhaps been asked in various formats by a number of attendees, and it is to you, Dr. Zane, and really just views with regards to a third wave. You spoke about them a little bit earlier, Prof, with regards to it is a bit of a delayed moment, but it is ultimately coming, and we need to prepare for that.
Arabile, I think that it's critical to understand that there's nothing different about South Africa than any other country in the world, right? That's firstly. I think we're speaking about trying to get the immunity of the community up to a point where we would have less incidence of COVID. But that concept of herd immunity has not held up, right? So from our epidemiology modeling group at HERA and the South African Modeling Consortium, we do anticipate an uptick. It'll start, we anticipate from a modeling point of view now that it'll start in the middle of May. Okay. That we will have an ever-increasing number of cases. The social distancing is dropping. People are getting lazy with social distancing. As we sit today, we have 3 districts in South Africa that have shown an increase in incidence, the Northern Cape, Free State, and the first uptick in the Northwest province. We are moving those into more surveillance strategies again. Indeed, I think that we're going to end up the third wave starting from those sites. Our cross-border colleagues or neighbors in Eswatini have definitely seen an uptick in cases. Okay. So indeed, I think that we're in for a third wave. There's seasonal reasons, there's economic reasons, and what we'd like to do is try and avoid a third wave that is greater than the second wave. Yeah. I would warn the public that our planning levels are for a third wave that is about 25% higher than the second wave.
Oh, wow. That's really not encouraging at all, actually, at this point. And hopefully we can all just be a little bit more aware. And as you said, we're becoming a little bit lazier. Let's all recognize that this is critical and very important at a time like this, that we don't get lazy. If anything, we increase our awareness. Please advise then whether the vaccine rollout is seen as an employee benefit. I suppose this question could actually go to you, Malusi, with regards to it. Is it then seen as an employee benefit?
Arabella, I think it has to be. So when we talk to employers, there's a few themes that come out when we think about the vaccine. So one is I want to focus on my core business. Two, I do want to do the responsible thing. But three, I also want to make sure that my business is sustainable in the long run. Yeah. And I think that when you take the vaccine, it starts to answer all those questions, especially once organizations are able to partner with credible companies that can help them in the vaccine rollout. It can help employers meet all of these three objectives and ultimately also be seen in the long run as a benefit for the employees themselves. We've got also the experience of the HIV/AIDS interventions that have happened in South Africa to learn from. And we know that those employers who were seen as proactive, who did the right things on the ground, were seen by their employees to be a lot more responsible, and they got the benefit of that. So I think it absolutely should be seen as an employee benefit, part of the employee value proposition that the employer provides, and something that helps with the long-run health of the workforce.
Yeah, so hopefully it gets to a point where it's officially sort of put forward as that, so that it does sort of help a lot of people as well. Then, and one of the other questions is, can an employer force the vaccine on its employees as a requirement of being employed? Can it basically be almost forced on you? You know, can it be a requirement when advertising jobs for new employees? Who is ultimately liable then for the cost in the above two situations as well? It's a lot of questions, but Dr. Strydom, I think that might even be best poised to you.
That is the most tricky one.
What are your thoughts on that one?
I'm not a legal expert. I think that to make it a requirement of a job to have a COVID vaccine is going to be quite a tricky thing. I mean, you know, you do have safety requirements, you have all those kind of requirements, but to have a vaccination as a pre-requirement or a prerequisite to be employed is going to be tricky, because if you do that, then you're actually discriminating against people who maybe can't have the vaccine. Maybe you've got a person who had cancer treatment, or, you know, who for other reasons can't have the vaccine. You know, they have half a lung or something, you know, so they can't have the vaccine. Then you're actually saying, well, then you can't work if you can't have a vaccine. So I'm not a legal expert, so I'm very hesitant to actually say yes or no. And I think that quite a lot has to happen in the labour legislation. You know, the conditions of employment in this regard before we can get to that decision, because currently, as the Act stands, you have to be fit for the job that you have to do. Now, if at the moment you don't have COVID and you're fit for the job that you have to do, and you're a young person, you're 24 years old, you don't have any comorbid conditions or whatever, you know, to make that a requirement is going to require a legal change, I think. You know, in South Africa. So, and I can't predict where that's going to go. I really can't. Dr.
Msimeki, I'm also going to perhaps pose this one to you, just with regards to people feeling like, you know, maybe they don't have a choice, that they feel like it might even be a little bit compulsory for them then to have to get this vaccine. Do you think that that's going to be the case here, that people are going to be almost forced to get one?
I also, disclaimer alert, just like Dr. Strydom, and like I said before, but I do think that because we've had so much, you know, spoken about voluntary aspects of vaccination, I do think we have to be very careful, and the employer has to be very careful that in any information that's provided, or even any encouragement that's given, is not seen as being coercive, that it's being forced on you, because that is clear in terms of, you know, your employment and your rights as an employee, that you can't be forced to do health or be discriminate on a chronic condition or another. So to go down the forced route will be difficult. Whether or not people feel forced is a different thing altogether, I think, in terms of your internal thought process depending on how your employer is and your colleagues are managing it. And I think that's where your education comes back as well, is when you are educating and are engaging with staff to really be battling out and tackling these difficult issues, then you can really be ensuring that you don't have a workforce that's also making other people feel forced to have the vaccine, but that rather people are making the decision from a base of being educated and from a base of freedom.
Yeah, so critical there to get that sense right. You know, how you feel versus also what is happening is going to be critical to discern, really, and measure against them. One of the other questions is, how will the country then deal with the anti-vaxxers and that lobby group? Prof. Zane, I don't know if you can perhaps answer this one. I mean, it's quite a big, it could be a big portion of the country as well. I mean, this happens with all other instances, not just COVID-19, right? And the anti-vax movement, if you want to call it that, is the real one.
So I have a number of answers for that, right? But the principal answers are pragmatic.
Okay.
There are people who say yes, there are people who say no, and there are people who are uncertain, right? So we don't have to persuade the yes. And in my view, we don't have to persuade the no. So be an anti-vaxxer, we're cool, you decide whether you want to get the vaccine or not.
Okay.
We don't have enough supply at the moment. The demand exceeds the supply. You rest. When you're ready, let us know.
Okay.
The group that we have to go after with good education is the uncertain, right? So anti-vaxxers and the yes group are competing for the uncertain.
Sure.
In the Sisonke experience, we have brought in volumes of vaccine every week, essentially for the last 10 weeks. We have had demand outstripping supply by multiples and have completed, in the main, all the vaccine supply within days of it reaching the ground. Sure. In terms of, can we force employees? So I'm the CEO of a group of 4,500 employees. I grappled with this situation as any other business does. And I think we have to be very neutral for as an employer group. We can provide more and more and more education, but indeed, as an employer group, we have to let the people decide. Our HIV's experience, I'm sure also care workers, is the trust levels rise. As you see your peers having the vaccine, as you see your aunt having the vaccine, as you see your grandmother having the vaccine, you will suddenly become more comfortable with this decision. And so the truth be told, these vaccine myths, social media, I have got to the point where I'm not even trying to answer, because indeed it's a wave. Vaccine hesitancy, sure, I'm hesitant. I got my ensemble study provided vaccine. I had received placebo in December. I participated in the study to advance science. I got my vaccine just 10 days ago. Sure, when I had the vaccine, I was hesitant. Sure, it was painful. And sure, I had symptoms that evening. But indeed, am I glad I was vaccinated? 100%. And so that confidence will rise as we show that we can do this efficiently, that the vaccine waiting times in vaccine centers are less than an hour, that it may be that the day or two after the vaccination may be inconvenient to you, that we can monitor the side effects, that we know who's getting side effects, that we can in fact improve the diagnosis and treatment of the rare side effects. All of that's happening. So the confidence levels will rise.
Yeah. My hope has always been, Prof, that if I do get I get vaccinated, hopefully, and if I do get a side effect, that at least it turns me into Spider-Man or Superman.
Right.
Then at that point, it would be great.
I have a wonderful quote, which is, if you think that your DNA will be changed by the vaccine, you should see this as an opportunity.
Okay, excellent. Okay, I need to get vaccinated very soon. One of the other questions is, can an employee then request not to be in a meeting with people that aren't vaccinated? I don't know, Dr. Strydom, this might be in your alleyway, I'm not sure.
Arabile, yes. I think that the answer there is to try and find a middle ground,
Yeah.
you know, a socially distant.
So difficult as an employer.
A socially distant middle ground. You know, and the fact is, if 67% of the employees are taking the vaccine, which is our, and say we get a couple more of the unsure,
Yeah.
and we go over 70% of people that are vaccinated, and you have a few that are not vaccinated, it's not going to be that hard to do the social distancing thing in terms of meetings and stuff like that. Because the fact of the matter is that if you've had the vaccine, you shouldn't really complain about the person in the meeting that hasn't had the vaccine.
Sure.
You know, that's just a political tool,
Yeah.
you know, because if you've had the vaccine, presumably you're now protected.
Yeah.
Okay.
Or you're
So-
better protected.
Yes, yes. So yes, you have to look out for the person who didn't have the vaccine, for sure. And I don't think that that's going to be an issue going forward. I really don't think that we need to preempt that. I think that it's one of those things in Pandemic 101 that we don't yet know. We're going to get there. And I think, as Ian says, there's going to be a wave of people who follow the wave of people.
Yeah.
And that's just social behavior.
Yeah, that's
We saw that with HIV as well.
Yeah.
I think if I can just add there, Arabile.
Sure,
I mean,
please.
The anticipation is that the vaccine status will be protected under protection of personal information.
Yeah.
So from a practical perspective, I think these are questions that may not even necessarily be there if you don't know who's vaccinated and who is at a point in time. So it's one of those areas where, you know, the law hasn't caught up. We don't know the full picture yet, but that shouldn't stop us from acting right now on the information that we've got.
Yeah. Very.
Can I also contribute one more?
Yeah.
So the data systems are laid out to, in fact, have unique identifiers for who has been vaccinated and who hasn't. And those unique identifiers will lead up to what is termed a vaccine passport. And as soon as anybody wishes to cross a border or potentially move a state in the United States or cross across European states, that vaccine passport will become evident. It is also critical that the ID number link to your vaccination, or if you're a foreign citizen living in South Africa, your passport link to that vaccination code is maintained, because it will lead to a vaccine passport. And while I am totally in agreement at the moment, we're going to leave this open and we're going to wait for the law to catch up, I do think that as a health business, employing healthcare workers, eventually we're going to have to make the decision that if you haven't had COVID, you don't have a positive antibody status, or you haven't been vaccinated, you will be less likely to get a job as a frontline healthcare worker, right? So I do think we are all being very politically polite here, but there will come a point in time where this will become a reality.
Yeah, because you're trying to mitigate it and stop the spread of it as much as possible.
So the other element that we have to balance, right, is there is an incidence of COVID.
Yes.
So Israel, which has got incredible coverage now, the incidence rates are crash low, right?
Sure.
And so suddenly then society opens up. We start actually getting these interactions, the commercial interactions, the shuls and the mosques in Israel can open, and everybody's getting on with their lives. If you come into that society, the airport will not let you in if you didn't have a COVID test at home,
Of course.
if you don't have a vaccine passport, and testing on site in the airport. So, you know, all of these sort of, you've got a population that's going to be, you know, successfully now protected. We're going to barrier that population even more. Whether we can implement it as successfully as Israel with our cross-border movements is a different question. But the question of getting coverage from a public health perspective to drive down incidence, that's what we're after, right?
Yeah. Look, globalization is going to be tested. I can tell you that much. That's for sure. All right, let's get to another one of the questions that have come through, and it's to you then, Malusi, and it talks about what will GAP do and how will it benefit our existing clients? What must the ER do, for example, and what does GAP do versus the other insurance? So is Old Mutual then differentiating themselves in this regard?
Sure. So we have already covered just some of the things that Old Mutual Group Assurance products, which is GAP, does for the various employers. You know, our first port of call is providing access to information around what it is that employers need to do to protect their population from COVID. That's obviously the historic things that we've done up until now. But one of the things we're introducing going forward is advice around the vaccine rollout readiness specifically. So there's an assessment that employers can do to see how ready they are, and they can get information about what the next steps are in their journey towards improving their readiness for this vaccine rollout. What we also are going to be doing going forward is that for those employers who want something that's a lot more intensive in terms of support for the vaccine rollout, in terms of the logistics, on-site support, etc., we can facilitate those conversations with our partners, and bespoke programs will be created for them, taking into account their objectives, their profile as an employer in terms of risks and so on, as well as their budget. So as the need evolves, our support services are also continuing. And obviously, we've got a number of initiatives at the employee level, which I've already mentioned. And I think for us as a mutual group assurance, our focus is on always being the most relevant for the employer. So we're constantly getting information and understanding what are the things that they're grappling with. And this is why this webinar is so important, and the questions that are coming through are so critical for us, because they're helping us to refine what additional services we can provide going forward. And if you listen to what Prof. Zane was saying, there's going to be a number of changes coming in the next while around availability, particularly for the third tier. And so we want to make sure that we're geared up for that for our clients and their employees.
Yeah, it's going to be so critical to be able to be geared up
Absolutely.
as much as possible for that. All right, Dr. Msimeki, let's perhaps hand this one over to you then. Can vaccinated individuals still be carriers of COVID? I mean, it's a massive health question, I suppose, but very critical and important. I get vaccinated, but could I still then carry it? Maybe not get affected myself, but carry it to other people.
So I think there's a lot of research that's still happening around vaccines, and in terms of how much will the vaccine protect you from being able to infect other people. The idea with immunity obviously being, if you're vaccinated, currently the vaccine aim is to decrease your chance of having severe disease or death. But until we have enough research that says you definitely cannot pass on an infection, the likelihood, I think at this stage we do understand this likelihood that you can still be infected and you might still be able to infect other people. But it might be that the infection that they get would be very mild infection or asymptomatic type of infection, but there's a lot of research that's still happening in that space. And as well, there has been some research coming out about breakthrough infections among people who've been vaccinated. But I think that let's watch the space. Currently, the thinking is your immunity is really, the vaccine aim is really to protect you against severe disease and death. And not so much that we're going to be curbing your ability to infect other people.
Yeah.
So
All right, so interesting there. Look, the questions just keep on coming in, and I mean, I'd love to be able to continue with this sort of discussion then for hours, because it helps alleviate sort of the stress, the strain, all those myths that we also have as well, right? To answer all of those questions as much as possible. And I hope we've been able to do that for the most part, at least. It is all we have time for today, but I'm going to then take this time perfectly, of course, then to give our panelists a moment then to offer our audience members just their final thoughts as well, and even suggestions on the COVID-19 vaccine rollout. Dr. Griekie Strydom, let's perhaps start off with you and get your closing thoughts here.
Thank you. I definitely think that my closing thoughts on the whole thing is that businesses must start this conversation. They must start interacting with their people, making decisions around what their response is going to be in terms of vaccinations, start putting their planning together. And as I said before, even if everything is not cast in stone or well known, they need to start. One can always change a plan as you go, but the important thing is to have the conversation and start getting ready, so that when things do fall in place, that the action. So it's my call to action to you, is to actually open the conversation. So go back to your companies and tomorrow start saying, guys, what are we doing about COVID vaccination?
Yeah, so important to prepare, get ready. All right, and engage, as you said a little bit earlier as well. Dr. Nkateko Msimeki, your closing thoughts then on this one, please.
I must admit they're very similar to Dr. Strydom's, and it really is, you want to collaborate, communicate, and educate. Because in order to be able to do all those things, to plan and such, you do. If you're an organization that hasn't started, it's not too late, just like Dr. Straden said, to do those things. You need to collaborate, you need to communicate and educate.
Yeah, thank you so much for that. All right, Professor Ian Zane, do you perhaps have any final thoughts to leave with us?
About 1,000. But,
we'll stick to 2.
So I do think so first off, thanks to Old Mutual for taking this up, because we have engaged, over the last 2 months to prepare for this this release and for this information exchange. My second thought is I am super keen to see the business sector taking responsibility. Because I believe that COVID transmission and risk is also driven by the employed sector as much as it is driven in our unfortunately less fortunate communities where transmission happens because of physical distance or lack thereof. But the employed group is the group that's mobile. That is the group that takes our South African variant across to the Zimbabwe border. It is the group that goes from their homes on taxis and to the workplace, and all of these potential transmission events. So I've encouraged both parties, the National Department of Health and the employed sector, to really try and get together, because the employer groups can efficiently implement this, so long as they take responsibility. And I would, as my last comment, direct everyone to a Daily Maverick article that Georgina Crisp has published that we supported, which indeed really shows us what we think the elements are, the cost elements, the reasons why. And, that's a sort of stake in the ground. This is what our opinion is. We hope that you can measure your occupational health and safety provider against that stake in the ground. We don't have all the answers, but we certainly have the models, and we're completely willing to share them. So, we want the public debate to continue.
Yeah, we continue to learn, right? And as things go along,
Correct.
We keep learning a little bit more and more as well. So very, very important. And finally, Malusi Ndlovu, you have the final word then as well for today, rounding off today's webinar for us, please.
Very difficult to round off after that. But what I will say is we support individuals' rights to choose. However, as a business, we have chosen to support the national vaccine rollout by government.
Yeah.
And we believe that employers, corporates, business owners have got a role to play. We've got access to credible, highly expert partners that can help with that in an efficient way, that doesn't disrupt business operations, that sets you up for long-term immunity and also opening up the economy as quickly as possible. Come talk to us. The details will be made available. There's a number of interventions that are already available to our clients. And if you're not a client of Old Mutual Group Assurance, why not? Maybe this is the opportunity. And as we're saying, building immunity is everyone's business.
Yep, it certainly is. Everyone needs to take a hold of it. Thank you so much to all of you for that. With that, then, we have now reached the end of this webinar. There have been so many trying to educate you, and we hope that this one has played that role too. Thank you again to all of our panelists for making the time to not just be here today, but to take part and give as much in-depth information as possible. And a special thank you as well to everyone who has spent the past 90 minutes with us. I hope that you have found it to be a very rewarding investment of your time to give that sense of understanding of what is going on. And it's a final thank you as well to our hosts today, Old Mutual Corporate, CareWorks, as well as Right to Care. Thank you so much to you. And also thank you to everyone. And please do enjoy the rest of your day. Try to keep safe. Remember, socially distance, wash your hands, vaccinate if and when you get the opportunity to do so, if that is your choice, of course. And please do stay safe. We'll hopefully be with you again very soon, maybe this time in person. It's a goodbye from me.